Now we're going to talk about syphilis.
Right. Syphilis is a bacteria that's a sexually transmitted infection that you can get usually from a partner who has an active sore or lesion or who has an active rash caused by the syphilis bacterium.
Yeah, your body has to actually touch the part of the body of the infected person where that little sore is. It will appear as a little brown, reddish freckle or sore, and that will come up and it could go away in a few days or a week, and that's telling you that you have primary syphilis.
And anywhere from a couple of weeks to a couple of months, you will probably break out in a rash. More likely than not, you'll have a systemic rash, won't realize what it was, and sometimes people misdiagnose it as maybe a contact dermatitis or you change your laundry soap or something.
Yeah.
But if you do have these kind of symptoms, you might also have a sore throat. You can also have sometimes some general fatigue, but usually that's very rare. Now you're getting tested for it, though.
Yeah, we recommend that you get tested. If you're having active sex, we recommend that you get tested for syphilis every 6 months. It's just something, if you have multiple sex partners, it's a good idea to put in your routine testing. So if you're doing an everything panel, throw the syphilis in there. It's definitely worthwhile because, it does hide and it can come back. It's absolutely 100% curable, but it's something that you definitely don't want to transmit to other people.
Right. If you do come back positive for your test, we run the initial, what's called an RPR, which will reflex or go to an automatic confirmatory test if it is positive. If that test is positive, you are contagious. You should not have sex until after you've been treated. And if you are positive, we will get the numbers to your local health agency or through your primary care provider. You can get treated for it. It's usually a shot.
Yeah, it's a shot, and then it takes a few days to, react and make sure all the bacteria and your antibodies are all taken care of. And then and only then should you go back and have sex with partners.
Right, and you do have to be aware that you may test positive for syphilis for the rest of your life. Now the thing is, you need to let your doctor know or your healthcare provider know that you've been infected with syphilis in the past, so they don't freak out if they get a little number.
Yeah, say this is an old infection. I have had tested positive at one point, so.
But it also means that you can test positive again.
Right. Syphilis is a disease that will progress and get worse. So if you come up positive for this, even though the sore goes away, it's still going back up into your system and can result in anything from loss of eyebrows to rotting your brain. So this is something that not only is bad for you and sexually transmitted, but this can really do you some damage and death if you don't get it treated. So please, if you're positive, go and get the treatment.